Good evening, and welcome to the grand opening of the Oral Health Clinic at Fanshawe College. We are so happy you're joining us tonight for this exciting event. Before we begin, we would like to acknowledge the Anishinaabe, the Haudenosaunee, and the Lenni Lenape peoples of Southwestern Ontario as the traditional owners and custodians of the lands and waterways where Fanshawe College is located. My name is Tony Millette, and I'm the Associate Dean for the School of Health Sciences, and it is my distinct pleasure to be your host for this evening. As a matter of housekeeping, if you have any questions during the event, please submit them through the Q&A function that can be found at the bottom of your screen, and we will try to answer them at the end. I would like to introduce Fanshawe President Peter Devlin, who would like to say a few words on behalf of the college.
Good afternoon, everyone, and welcome to this exciting event. I wish we could celebrate in person, but that is something we can look forward to in the future. Fanshawe students have faced challenges and uncertainty over this past year, and I'm immensely proud of how they have risen to overcome them and thrive. These successes would not have been possible without the continued dedication of our great faculty. I thank each of you who are here with us this afternoon for your support and hard work. As a college, we have had our own challenges during the pandemic. I am very pleased that Fanshawe has been able to continue construction during the last year, allowing us to move forward with our campus improvements. It hasn't been easy, but this beautiful state-of-the-art facility is a prime example of how the college has updated its facilities for current and future students. We are committed to excellence in education and contributing to the health and well-being of our community. This clinic is a learning lab for our students. It will allow them to hone their skills while caring for those who need accessible, affordable dental care. We look forward to working with each of you here today as we strive to ensure our students continue to have the best education possible and our community has access to outstanding care. Thank you, everyone. And I would now like to introduce the chair of Fanshawe's Board of Governors, Brad Duncan.
Thanks very much, Peter. It is my pleasure to be here today representing Fanshawe's Board of Governors. The college is excited to open this facility. We have been planning it for a long time. The hands-on learning that will take place in this first-class lab is extremely important to our dental hygiene and dental assisting students. As well, the quality preventive oral health services they will be providing to the most vulnerable within our community who may not have access to care is extremely important. This vital, much needed service is really a win-win for everyone. Many of you here today are current or potential employers of our students and graduates. I would like to personally thank you for providing our students with real-life experiences during field placements and for hiring our graduates after they have completed their programs. You are helping us shape the dental hygienists and dental assistants of the future. The experience they gain ensures our graduates are prepared to fill critically needed positions as important members of healthcare teams within our community. I would also like to thank the registered dental hygienists, faculty, and licensed dentists who supervise these students as they learn clinical skills and the highest professional standards. This is truly a team effort. Once again, thank all of you for joining us here today. I hope you enjoy the rest of the event.
Thank you, Peter and Brad. We are also very excited about the opening of this amazing clinic. Phil Surtees is the chair of the Fanshawe Foundation, and I would like to invite him now to say a few words about the foundation.
Thank you, Tony. As a volunteer and chair of the Fanshawe College Foundation, it's inspiring to participate in this remarkable day for Fanshawe College, and in particular, the School of Health Sciences. I'm delighted to celebrate the opening of the Oral Health Clinic with you. Fanshawe's programs in dental hygiene are known for delivering excellent oral health education. With the services in this field constantly growing and advancing, many community supporters, partners, and donors have done much to shape, inform, and strengthen our programs. There are people joining us today who've provided student awards, made placements available, given good advice, shared expertise, and supported our programs. Thank you for your many contributions. And to those of you who've already made a meaningful investment in the Oral Health Clinic, we extend our profound appreciation for your support of this timely and important initiative. Your generosity symbolizes the importance of giving back, of fostering and advancing the quality of education for future oral health professionals while helping others less fortunate in our community. The School of Health Sciences has made valuable contributions locally, nationally, and globally. Working collectively and with your commitment, Fanshawe education will continue to be at the forefront of excellence and innovation, and our grads will embrace a promising future. I extend my sincere appreciation to you all as we celebrate this new chapter of oral health education. Thank you.
Thank you, Phil. We'll now hear more about the clinic itself from Sylvie Richer, who's the manager of the Health and Wellness Clinics at Fanshawe College.
Thank you, Tony. Hello, everyone. Thank you for joining us today. We hope you're as excited about this new space as we are. As Tony mentioned, my name is Sylvie Richer, and I'm the manager of the Health and Wellness Clinics here at Fanshawe College. While I would love to be able to provide you with a tour in person, it's my absolute pleasure to provide you with a pictorial tour of our clinics. The design of the clinics was a collaboration between our leaders and the faculty. In this first slide here, you'll see on the left that everyone is greeted at the reception area. And the main clinic itself consists of 16 fully functional operatories. Each operatory has 2 computer monitors that can assist with electronic health records and client education. And each operatory also has its own ventilation system that assists with providing clean air to the area, along with managing our file times. We've also installed plastic doors to comply with regulations for aerosol generating procedures. This slide here demonstrates our radiography suite, which has 6 fully functional operatories capable of being utilized for restorative procedures, such as restorative procedures during our dental assisting program, as well as operatories for our dental hygiene students. Each operatory here also has its own ventilation system and doors that allow for aerosol generating procedures. As you can see on the photograph on the right here, we have mannequins that are utilized during teaching. We also have a separate room with a panoramic machine. There's one operatory in both the clinics, the main clinic and the radiography clinic, that's fully accessible. Those rooms are a little bit larger to accommodate wheelchairs. And they each have additional ventilation capacities by way of a portable air purifier. This is our simulation clinic. We're incredibly proud of it. It has 20 operational chairs. Much thought went into the design of the space to accommodate the dental hygiene teachings. And within this space is the ability to project videos or demonstrations from the front instructor area onto the screens at each station. Our dental software program is installed at each station, providing the students the opportunity to practice and learn the programs. The back of the simulation clinic, you don't see it in these photographs. It's designed to simulate a dental office sterilization area, and it's fully functional. So the students get to practice the process of sterilization with simulated instruments rather than in our large institutional equipment that's in the reprocessing area. At the back of the clinic is the wet lab that we affectionately call it as, and it has 8 stations with lathes and trimmers, and it's a fully functional dental lab. This here is our sterilization area, or instrument reprocessing area. On the left is the decontamination room. And it is where the instrument cassettes are put into two large washers right here. And then this section here is the door openings of the washers. The instruments are taken out of there and then brought into these two industrial sterilizers right there. Once the instruments are all clean, they're stored to these little cubbies, which is a really neat design because in the clinic area, there are lockers and the students can access their clean instruments from there. So it's a one-way flow design that's really well thought out and works really, really well for us. I'd show you a photograph of our before and after, a complete separate section of the college, but on the top left here is the simulation area where they were practicing dental materials, and this is the new area here on the right. Bottom left, obviously pre-COVID, our clinical chairs, and now on the right, bottom right of this photo, this slide is the new clinical space. Just a lovely, lovely space to be in. We're incredibly proud of it. As I mentioned, we're incredibly proud of the space, but the excellence that our program delivers would not be possible without the outstanding and dedicated faculty that we have. Many of them have made their lifelong careers in our dental programs. They all have complementary graduate level degrees such as public health, science education, and adult education. We work collaboratively to reach the common goals of educating future clinicians and serving the communities in which we live. Another aspect of our clinics that we're incredibly proud of is our adherence to Fanshawe's sustainability endeavors. We strive to deliver an important service to the members of our community. We're continually looking at our processes and investigating whether we can improve them. Some examples of our commitment is to electronic record keeping, allowing our clinics to be paper-free, and also to digital radiography, meaning that there are no harsh chemicals stored or disposed of. We're also beginning to investigate a recycling program for our gloves. We're delighted to share our clinics with you and the good work that we do, and thank you for being here today. Here's a brief video that highlights our clinics. It is my pleasure now to introduce you to Ken Wright, who is a professor in our dental hygiene program.
Great. Thanks so much, Sylvie. So as we can see from the video and Sylvie's presentation, our students are really well positioned to provide exceptional client care in these state-of-the-art facilities. One of the many reasons why we're so excited for the new clinic is our ability to address some of the unmet oral health needs experienced by members of our community. While we've been servicing these needs for many years at our previous location at the Schulich School of Medicine and Dentistry, our very own clinic allows us opportunities to partner with different agencies and explore unique ways of making preventive oral health care more accessible. With over 70,000 Londoners living in poverty and a lack of access to employer-paid dental insurance as one of the major predictors for oral health care utilization, our clinic plays a vital role in providing accessible preventive oral health services to maintain the health of our teeth and gums, which we know is a vital part of overall health and well-being. So how will Fanshawe's clinic make an impact to our community? Accessibility at the Fanshawe Oral Health Clinic has been integrated into the clinic's design, as well as the processes that we have in place to service our community. Our students are available to book appointments for clients during daytime and evening hours with a schedule that can cater to both retirees, as well as those working who may not have the luxury of taking time off for dental appointments. Our clinic is conveniently located on several major bus routes, which ensures that folks who don't have access to a vehicle can reach our clinic with ease. For those with vehicles, we offer free parking, conveniently located in the immediate vicinity of the main clinic entrance. Our clinic is located in the main floor of A building with several accessible operatories, as Sylvie mentioned, for those with wheelchairs or accessibility needs. We also have fees that are approximately 60% less than the current ODA fee guide, making our services considerably more affordable. And we accept all prospective clients. So whether you have access to private dental insurance or for those clients that are paying out of pocket. Our fee guide is available online, along with parking information and location information. So feel free to check out our website. The new oral health clinic will complement our existing community outreach initiatives. And here at Fanshawe, we're so fortunate to have some really exceptional partners that not only provide a unique learning experience for our students, but also allows us to give back to our community. We have a long-standing partnership with Southwestern Public Health and the Middlesex London Health Unit, where dental hygiene and dental assisting students partner up to deliver oral health education lessons in toothbrushes to elementary school children from Woodstock, Aylmer, St. Thomas, Strathroy, and London as well. In the 2018-2019 academic year, our Fanshawe students delivered almost 2,500 toothbrushes to elementary school children. This past academic year has been a challenge for all of us on so many different levels. However, it has sparked some new ways of learning and some new opportunities. I'd like to give a special shout out to Dina and Susan from the Alzheimer's Society for working with our second and third year dental hygiene students to facilitate a virtual reality experience with embodied labs. This unique workshop allowed the students to appreciate the cognitive changes that come along with Alzheimer's, that will provide empathy and understanding and the necessary understanding to work with clients and families that are going through that particular journey. We also had an opportunity to facilitate a virtual interprofessional education workshop with Dr. Sean Steele, who's the site chief of dental clinics at LHSC, and also he's also assistant professor at the Schulich School of Medicine and Dentistry. So we had dental hygiene and dental students working in small groups on Zoom virtually over 2 sessions to learn about the roles and the scope of practice of each profession and how we can work together collaboratively through a case study scenario. So thank you, Sean, and the dental class of 2023. It was a really great experience for all of us. Some exciting new initiatives to increase access to care for our community include a partnership with Youth Opportunities Unlimited, where clients accessing support from you are referred to our dental hygiene program at the Oral Health Clinic to receive preventive services. At Fanshawe, we're also very fortunate to have a brand new placement opportunity for our dental hygiene and dental assisting students, which is the Wright Clinic. So this is London's very first not-for-profit community-based dental clinic. This learning opportunity is going to allow Fanshawe students to experience firsthand what community-based oral health care is all about and why it's so important to take action, to collaborate with persons with lived experience, community members, and health and social service organizations outside the field of dentistry in order to really make a difference. So at this point, what we would like to do is show a video from Dr. Ken Wright. Dr. Wright is the director of the London Community Dental Alliance, which manages the Wright Clinic. Dr. Wright is also a retired adjunct clinical professor from the Schulich School of Medicine and Dentistry, where he's taught for over 44 years. Dr. Wright has a close partnership with Fanshawe and has for many years, starting in 2008, when he and Caroline Lotz, the Fanshawe Dental Hygiene Program Coordinator at the time, worked to launch the Dental Outreach Community Service Program. So here's Dr. Wright, who's kindly agreed to say a few words today.
Thank you, Lara, for those kind words, and good day, everyone. Okay, this is a great day for Fanshawe and a great day for our community. Okay, I'd like to congratulate the college in seeing the need for improved oral health care in our community and taking steps to meet this challenge. Okay. During the past 15 years, my background has been involved in trying to bring affordable dentistry within our community, okay? And it was the request for help from a specific area of our city, which was high in refugee and immigrant population, that actually spawned the development of the DOCS project, okay? DOCS, which stands for Dental Outreach Community Service, is really what this is all about today. The DOCS program is a wonderful example of bringing together two institutions, Fanshaw's Oral Health Department and Shulg School of Medicine and Dentistry. And it enabled the school to have students, along with professional staff, treat patients who were finding difficulty and affordable dentistry. Okay. The DOCS program was really also the catalyst in 2018 to establish a permanent outreach dental clinic. And after 3 years of effort, I can say that we do now have a permanent outreach dental clinic on Adelaide Street South called the Wright Clinic of all names. Okay. Fanshaw's involvement with the establishment of the DOCS program and the Wright Clinic are ideal examples of the persistence and support with which we've been able to develop these projects, and certainly the creation of your own dental clinic here at Fanshawe. This beautiful clinic will not only enhance the education of dental hygienists, but dental assistants, and as well provide available space to treat more patients. So congratulations. It's been an honor to work with this excellent staff at Fanshawe, and I appreciate the invitation to come and enjoy this occasion with you.
Thank you, Dr. Wright, for your support of our students and the many contributions you've made to the community. Our next video is from Dr. Hisham Shurgen. Dr. Shurgen is an enthusiastic and proud supporter and employer of Fanshawe College dental assisting and dental hygiene graduates. He is a member of our program advisory committee and is a clinical dentist for the dental assisting program who shares his love of lifelong learning with our students and our faculty. Dr. Shurgen has several dental practices in the London area, including West 5 Family Dental, Village Walk Family Dental, and Stony Creek Family Dental.
Hi, thank you for joining us today. My name is Dr. Hisham Shurgen, and I'm a practicing dentist here in London, Ontario. I'm a proud member of the Fanshawe PAC committee, and I'm honored to say that we have built a phenomenal facility here in London, Ontario for our dental assisting and dental hygiene programs. It has been incredible to see the growth of both programs over the past several years, and Fanshawe's constant contribution to the dental community and to the community as a whole. So I encourage every one of you guys to come in, check out the new facility, and support our program. Have a wonderful day.
Thank you, Dr. Wright and Dr. Shurgen. We look forward to your continued support of Fanshawe College and our students. Our Dean of Health, Community Studies, and Public Safety, Pam McLaughlin, has been such a strong supporter for this facility for so long. I would like the opportunity to invite her to say a few words. Pam?
Thank you, Tony. I want to say what an exciting day this is for the School of Health Sciences. We've been anticipating this facility for some time, and it's come to fruition to be open to the public, and it's simply amazing. The Oral Health Clinic allows us to actualize a long-held dream and fulfill one of our missions, which is to provide care for the most vulnerable community members who do not have access to oral health care. Our clients will come to us from schools, the Inter-Community Health Center, and my sister's place. And our faculty and students will work with individuals or population groups which ensure that everyone can come to our clinic and receive the services that they require. The care provided by our students under the faculty's guidance will provide research opportunities for both faculty and students and support research presentations at conferences. We will have the capacity to invite more students into our dental assisting and dental hygiene programs in order to supply the needs of dental offices in London and beyond. I would like to thank our program advisory committee members, which include dentists, dental hygienists, and all who have contributed to the success of the dental hygiene programs. They are all integral to our success, and we thank you.
Thank you, Pam. Thank you for joining us at this event. We look forward to welcoming you to the clinic in person very, very soon. Jillian Snedden, Executive Director of the Fanshawe Foundation, will give some closing remarks. Jillian?
Thank you, Tony. I'm delighted to share this early look at the new clinic and have the opportunity to provide updates about oral education at Fanshawe College. As the Executive Director of Advancement, I'm continually inspired by the generosity of our donors, our partners, and our supporters. They all play such a vital role in providing first-class facilities, resources, and exceptional learning experiences for the dental hygienist and dental assisting students. They really make it possible for Fanshawe College to provide the outstanding education that it does. So thank you to all of our generous donors who are joining us today. The college has set an ambitious goal to raise $500,000 to support the successful completion of the clinic and to empower students to become the highly skilled members of our healthcare community we know they all want to be. I would like to extend a personal thanks to two community partners, PAL Laboratories and Sony Dentistry, who have confirmed their generous support to this project. So thank you to both of those groups. There are a number of giving possibilities that will appeal to both personal and corporate donors throughout the new clinic. Donors will have the opportunity to select spaces where they would like to put their name to recognize and acknowledge their support and commitment to Fanshawe College and to our oral hygiene clinic and programs. So on behalf of Fanshawe College and its foundation, a most grateful thank you to all of you for your generous support. And I look forward to working with you in the coming months to make your philanthropic vision a reality. Thank you.
Thank you, Jillian. As promised, we'll now open the floor to any questions that you may have about the oral health clinic at Fanshawe College. I'd like to welcome back a panel because I don't want to answer all of these on my own. So Jillian Snedden, Executive Director of the Fanshawe Foundation, Sylvie Richer, Manager of the Health and Wellness Clinics at Fanshawe College, Lara Timler, Professor in the Dental Hygiene Program, and our two program coordinators, Jennifer Cooper with the Dental Assisting Program and Kelly Turner with the Dental Hygiene Program. So the first question I'm going to put to both of the coordinators, I'll put them on the spot right away. It says, with the new clinical space, are you able to increase enrollments in both of the programs? So we'll start with Jennifer and then we'll finish with Kelly on this one.
Thank you, Tony. The dental assisting program has actually been able to expand the program by 8 students this year, and we will continue to accept those 8 students going forward, moving from up to 64 students.
And Tony, thanks for the question. So in dental hygiene, we do have plans, and this was incorporated in the facilities, that we would like to go from 32 students to 40, although we're trying to be conservative, just watching what's happening with the pandemic right now. But those plans are in place, and we're excited to offer that to students.
Okay, very good. I'm kind of hesitating on the next one. Is there anything in the clinic that you would like to have access to that you don't have already? So this we'll start with Sylvie, and then maybe some of the faculty folks if they wanted to add in their response.
Thank you, Tony. In thinking about the dentistry and how fast everything evolves and how technology evolves so fast, it would be just incredible to be able to expose our students to a lot of these new techniques, new developments, new pieces of equipment. And so one of the things that we would love to be able to do is establish relationships with industry partners And with those relationships, we can invite them to the clinic and provide these learning opportunities to our students. One of the things that I can think of off the top of my head would be digital impression taking. We are still mixing the old alternate materials, which is good, but technology has evolved so nicely with digital impression. So to be able to introduce that to our students would be great. So that's one.
And from the others? Or are we good?
Thanks,
Yeah.
Sylvie. I think the dental assisting program likes what Sylvie had to say, so thank you.
So with the new clinic, do you have the ability to offer continuing education courses to the dental community? Sylvie, I think maybe you want to take this.
I would love to answer that question. We would be delighted to maximize the space that we have, especially on weekends, and offer ongoing education that's mandated, right, by dental hygiene colleges and dental colleges and dental assisting certifications as well. And so another thing that we would like to do is do a needs assessment and see what gaps are out there in the community, in the dental community, and to see how we can serve those gaps. So, for example, micro credentials, what I can think of right now would be sort of a dental receptionist type training that would be an adjunct to dental assisting and allow those graduates to have a broader skill set and be certainly a lot more employable, although they're very employable now. So we're definitely looking at those opportunities and hoping to maximize them. Great question.
We've got a couple of congratulatory, not really questions, but just making statements, and they're very proud for us. So thank you so much for that. A question, are there applied research opportunities for students and faculty? Lara, maybe you want to take this one.
Sure. Thanks, Tony. I think we would be really excited, and we would welcome any opportunities to engage in any kind of applied research opportunities with our dental programs. Now that we have these really amazing facilities, we have kind of the right environment, right, to kind of take it a little bit further and to engage in some applied research. And certainly Fanshawe is a leader among the community colleges in Ontario in regards to applied research. So we've got lots of research expertise among our faculty members, and now we have the great facilities to support that important work. So by all means, reach out to likely program coordinators Kelly Turner and Jen Cooper, and we can move that forward, hopefully.
Okay, thanks so much. So there's a couple of questions. They're kind of close together, so I'll pitch them both. And so one will be towards Jillian and one would be towards Sylvie. So it's about connecting with the clinic and connecting with the foundation and to be able to support on either. So Sylvie, how does someone access services at the clinic? And Jillian, how does one access your area to possibly donate?
Sylvie, do you want to go first?
Certainly, thank you, Jillian. I invite everyone to visit the Oral Health Clinic website. So if you just do a quick Google search, Oral Health Clinic, Fanshawe College, the website will populate in that browser, and there is contact information on how to reach us by telephone, by email. There's even a client intake form that you can complete, and we will reach back out to you. So I invite you to do that, and we'd be delighted, absolutely delighted to welcome you into our clinics.
Thanks, Sylvie. And like Sylvie, if you are interested in learning more about how you can make a gift either online or as part of a collective campaign, you can actually click on the Fanshawe College website, and it will actually direct you to a link that opens up a page where you can make a gift specifically in support of the oral hygiene or the oral health clinic or the program. In addition to that, everyone who participated today will be getting a personal thank you email, and embedded in that email will be those links and contact information for my colleague Mary Flanagan-Hawken, who's really leading the efforts to work with donors in our community and engaging them with this program philanthropically.
Okay, thanks so much, both of you. Are there currently any jobs available with the faculty and working with the students at the clinic? Very good question, and maybe I'll take this one. So currently we look at a needs basis for each semester, and we look at student intake, and we look at our what our needs are essentially semester by semester. So we kind of measure that going by student numbers and budget as we move forward. So we're always looking to expand our depth of faculty and technologists and technicians that work within the programs. So, if there's interest out there, please connect with the college and express that interest. Is there financial assistance for clients who need it? Sylvie, maybe I'll direct that one to you.
That's a really good question. And Lara, please interject, since you seem to be the one on the pulse of the community events. But at this time, we do not have specific programs lined up for financial assistance, although our fees are just a fraction of what the regular fee guide is. We have spoken with some organizations with regards to associating with them, and financial assistance would be provided that way, but nothing at this time is concrete. Lara, do you have anything to add to that?
Yeah, it's a great question. And I would say, depending on financial assistance, of course, there's, certain programs that are out there, like Ontario Works wouldn't qualify you for services at our clinic, but there is Ontario Disability Support Program for adults, and then the Healthy Smiles Ontario program for children, and then the Ontario Seniors Dental Care Program. And there is some eligibility expansion with that particular seniors program. So for the seniors program, the Middlesex London Health Unit is the contact there, because the program is delivered through the health unit. It is a government program, but as Fanshawe is a partner with the Wright Clinic. And so the Wright Clinic is a really amazing opportunity for London for us to really help support some of the most vulnerable in our particular community, especially those who don't necessarily have the financial means to pay for dental care. So I encourage you to take a look at that website as well. It's just wrightclinic.ca. Our clinic here at Fanshawe, we're able to provide preventive oral health services. And again, as Sylvie mentioned, our fees, feel free to take a look online, but they are, really quite accessible and affordable for a lot of folks. So there are quite a few avenues that are available, but certainly check out the Wright Clinic if it's more dental care and emergency care that you're looking for. And then of course, our students for the preventive oral health care piece.
Okay, that's fantastic. We have a question here. Is Fanshawe completely independent with the new clinic, or will you still be accessing the Schulich Dental Clinic at Western to accommodate all of your dental assisting and dental hygiene students and patients? Kelly, maybe I'll steer this one to you.
Yeah, thank you, Tony. We've had a long-standing relationship with the Schulich School at the dental clinic, and we are hoping to maintain some of that even for some of our clients that we may have some shared clients. But we are an independent dental oral health clinic. We have registered dental hygienists working with us and dentists as well that will be able to provide full preventive services. And if there is need for any sort of restorative dentistry type needs a client might have, we are hoping that we'll be able to work with Western, or if someone has a private dental practice in the community, we can do some referrals. But this is what we're so excited about, that we actually have this independent dental clinic, and sky's the limit with what we will be able to offer the community. So thank you for the question.
That's fantastic. One of the great things of having a virtual open house event is that you have some people who can help you out with some clarification. And so a personnel who works with us in another area is making a comment that the college has numerous Employment Ontario offices where we can support clients financially to have these appointments. So keep asking your questions, and if we can't answer them right away, we'll definitely get to you with those answers. Someone has written in, what challenges did you face creating such an amazing space during this unique and difficult time? And How are your team and your students overcoming the challenges presented by the pandemic? Wow, what a question. And we only have 20 minutes. So what we can say is that, yes, it's been very unique. It has been very challenging. It's everything changing constantly, consistently. And one thing that we do know is that we're extremely resilient and that we've worked through this as a team. Sylvie, anything you want to add to that? Being with the clinic?
Overcoming challenges presented by the pandemic, we are not able to work at full capacity. And so we have very, very restricted numbers in the clinic, and we're working with that, but that requires extra groups in the clinic. So we've been functioning 7 days a week, morning, afternoon, and evening, to get these competencies completed for our students. And this is possible because of the amazing faculty that is on board, that is able to pivot on a dime whenever the regulations change and do some rescheduling. It's been a challenge, but we're so excited about the space that we've been able to overcome it. And our common goal is to get these students graduated and done. And we're doing just an outstanding job in getting that accomplished. Lots of challenges, but we're overcoming them and successfully graduating the students. That's a great question.
Yeah, thank you for that. This one's got Sylvie's name right in it, so we'll keep with you, Sylvie. Sylvie mentioned establishing relationships with industry partners. So what is currently being worked on to support patient resources and student education via these partners?
This is a great question. I've been working with the development team to establish these relationships. And our goal is to be able to bring these relationships, these industry partners into the clinic, into the students, so that they can educate them. When our students graduate, they must be able to make informed decisions on evidence and what's available. And so by joining with these industry partners, I feel that we're able to provide that to them in a really good way. So we're working with the development team and hoping to pursue these endeavors. I hope that answered the question.
Okay, just looking, make sure I haven't missed anything. Okay, here's one for faculty, and I'll let all three of you take a stab at it, because you all, either in different programs or different courses. How will this new space change the professors' teaching strategies? Maybe we'll start with Lara, and then Jennifer, then Kelly.
Well, that's a great question. It's just going to open, so many more opportunities for our students, because we've got these state-of-the-art facilities. Our simulation lab is amazing. We're so excited. And as you can see, Jen has got the sim lab virtually behind her. So it really allows us to kind of really integrate and support student learning from both the clinical point of view and to support their didactic learning as well. So being able to have these facilities really mimics, real life and what private practice is all about in terms of our clinic and our facilities. And it also, really helps us train students to kind of really adapt to what the workplace looks like right now, right? So we're very, very excited for these facilities.
In addition to what Lara said, the dental assisting program is very excited that we actually have 6 fully operational restorative rooms. So that has given the dental assisting program the ability to run full restorative simulation procedures. And we actually were even able to run simulated extraction and endo procedures this year. So it's really allowed us to tie in everything and give some real hands-on experience in all aspects of the dental assisting field.
And I would just like to mention one of my favorite areas as the radiography teacher, that the faculty was able to put our own fingerprints on what we wanted. And we really were able to put our wish list and to see it in completion. So in the radiography area, we have the most up-to-date digital radiography. We actually have the 2 different technologies that we're teaching our students as well. Now we also have a panoramic. So that's new for us to actually have access to a panoramic, and it's also digital, and the software that the students are learning. So they're learning radiography software. They're learning a software that we use in the clinic that's a teaching software, but they're also going to be learning some other common softwares, Tracker, Dentrix, other ones that we know of that are still being used out in the community. So we're just excited that we'll be able to change some of our curriculum and just keep up to date with the changing technologies.
Okay, thank you. And with that, just checking to make sure. Oh, another one just came in. Oh, just someone else just saying that how happy they are for us for this amazing space, and we can't wait to see what comes next. And I think that's a great way to end it, because it is what comes next that's just going to be just as amazing. So this brings our event to a close. If we've missed any questions, or you have some questions you're sitting on the fence, please reach out to us and we will get back to you directly. Thank you for joining us, and enjoy the rest of your evening. Good night.